So hey everyone, welcome to CoreVet. So today in this particular video lecture, we'll be discussing about the trigeminal nerve. Okay, so before starting learning about the trigeminal nerve, I hope that you have a sound knowledge about all the foramens that are there in the skull. Because if you don't have an adequate knowledge about the foramens that are there in the skull, so it would be harder for you to just recognize all the path of the trigeminal nerve. Because in this trigeminal nerve, we will be letting you know about how the trigeminal nerve is going to be passing from the foramen ovale, foramen orbitorotentum, and many more foramens that are there in the skull. Okay, so I hope that you are clear with the concept of the foramens that are there in the skull, because it is necessary to know about the base before starting the anything else, right? So starting with the trigeminal nerve, it is the fifth cranial nerve. Okay, so here's the general information regarding the trigeminal nerve. So if we talk about the trigeminal nerve, see, there are four things that you have to know. That one thing is the largest cranial nerve, longest cranial nerve, smallest cranial nerve, and longest nerve. Okay, so these four things you should be clear with. So whenever anyone asks you about the largest cranial nerve, okay, so you have to name it trigeminal, right? If someone asks you which is the longest cranial nerve, then you answer vagus. Okay, the vagus nerve. If someone will ask you that what is the smallest or which is the smallest cranial nerve, then you are going to answer that as the trochlear nerve. Okay, and in your body, the longest nerve is sciatic nerve. Okay, so these are the 4 points that you should be clear with. Okay, so here's the general information about the trigeminal, that it is the largest cranial nerve but not the longest. So I had told you which is the longest. It's the vagus. Okay, so it carries both the sensory and the motor functions. Okay, both the function it is performing. Okay, so the trigeminal is going to perform both the function. It is also functioning as a sensory nerve, and it is also functioning as a motor nerve. So the sensory innervation is with the face, the teeth, the oral cavity, and the nasal cavity, right? And the motor function is with the facial muscles. So all the facial muscles, for example, the masseter muscle is going to be innervated by this particular trigeminal nerve in order to just help in the process of the mastications, right? So what's the positioning of this particular trigeminal nerve? So if we go by the axis in the 3D, okay, so understand like this. Okay, so this is your pons. Okay, so the positioning or the origin of the trigeminal is anterior. Consider this as anterior. Okay, this is the midline, this is the midline, middle line. Okay, this is your pons. So the origin of the trigeminal nerve is anterolateral, means moving towards the outward and toward forward. Okay, that's how the origin of the trigeminal is. Okay, so it is attached at the anterolateral aspect of the pons, okay, by a large sensory and a small motor root. Okay, so the sensory root is represented by the either the it is known by the three names: the trigeminal ganglion, the Gasserian ganglion, and the semilunar ganglion. Okay, these three names are given to the sensory root of the trigeminal nerve. Okay, and it is present at the apex, means if this is the petrous temporal bone, then it is present at the apex. So this is the sensory root of trigeminal, right? And the motor root passes beneath it without any connection, means the motor root is passing beneath it without making any connection, right? So coming on to the functions of the trigeminal, as I had told you that it follows both the sensory and the motor functions, right? So the efferent functions, it receives the sensation of pain, touch, temperature from the facial skin, teeth, and the gum. Okay, so means, see, wherever the nerve is going to innervate, it will carry some sensation from that particular part, right? So what kind of sensation it could be? It could be either the pain sensation, it could be the touch or the temperature. Okay, it could be having all those particular sensations wherever the nerve is going to innervate or going to supply, right? Now the efferent functions are that the muscles, because there are several muscles that are going to be innervated by the trigeminal nerve or the trunks of the trigeminal nerve. Okay, so the muscles of the lower jaw is there supplied by the trigeminal nerve for its movement. Okay, so what is happening that the trigeminal is going to supply what? The jawbone. For what? The jawbone muscles, right? It's going to supply the jawbone muscles. For what? For its movement. And for what the movement is necessary for? It is for the mastication purpose, right? Now moving forward with the origin of the cells, from where the motor nuclei and the sensory nucleus originate. So the sensory nucleus is going to be originated from the pons and the spinal cord. Means there are two kinds of the nucleus from the trigeminal. One is the sensory nucleus and second one is the motor nucleus. The sensory nucleus is going to be originated from what? The pons and the spinal cord. And the motor nucleus is going to be originated from what? The pons. Okay, I hope this part is clear. Now we are going to talk about the three trunks that are going to be originate from the semilunar ganglion or the Gasserian ganglion. Okay, so what are the name of the three trunks? So the first trunk is the ophthalmic branch of the trigeminal, the second is the maxillary branch, and the third one is the mandibular branch. Okay, so the two branches, which is the ophthalmic and the maxillary, is going to be originate from the foramen orbitorotendenum, right? And the last branch, which is the third branch, is going to be originate from the foramen ovale, which is what? The mandibular branch. Okay, so just make a stepwise concept that how the trunks are going to be divided, right? And after the trunks are going to be divided, from which foramen they are going to pass. Okay, so there are three trunks. One is the your ophthalmic branch, second is the maxillary, and third one is the mandibular branch. So the first two branches, which is the ophthalmic and the maxillary, they are going to originate from what? They are going to originate from the semilunar ganglion and going to pass from the foramen orbitorotendenum. Okay, then there is the mandibular branch, which is going to be passed from the foramen ovale. Sorry. So here you can see that it's the diagram from the book R.K. Ghosh. Okay, you can refer that book. So you can see here that this is the your semilunar ganglion, which is I'm highlighting with red. Okay, so this semilunar ganglion is going to originate three branches, which is the mandibular, the maxillary, and the ophthalmic. And it is the sequential movement of the nerve or the branches that are going to be supplied by the trigeminal nerve. Okay, so if you're going to remember that particular diagram, it would make you much more easier to just write down a descriptive answer for this particular trigeminal nerve. Okay, just remember that particular diagram, have a concept on your mind, and it would make you much more easier. Apart from mugging it up, it is more important that rather you learn the positioning of the nerve and how it's going to supply, because you can write the answer in your own word. If you know how you have to, the concept is clear, you can write the answer on your own, right? So it is much more easier to know. Now moving about discussion. So the very first branch is the ophthalmic branch. Okay, so how the movement of the ophthalmic branch is. So after the origin from what? The semilunar ganglion, it is going to pass from the foramen orbitorotendenum, as I had mentioned it previous also. And then what? It is going to pass from this superior orbital fissure. When it will be going to pass from the superior orbital fissure, it will pass through the orbit and give out four branches. Okay, it will give out four branches. The very first branch is the zygomatico-temporal, second is the lacrimal, third one is the frontal, and fourth one is the nasociliary branch. Okay, so talking about the zygomatico-temporal, So how the movement of this particular zygomatic temporal is, so it's going to move from the dorsal lateral aspect to the ventral border of the lacrimal gland. Means, consider this is the lacrimal gland. Okay, lacrimal gland, right? Consider this to be the ventral border of the lacrimal gland. Ventral border, right? So how it going to move? It will move in the dorsolateral aspect, means upward and outward. That what's the dorsolateral means, right? It is moving laterally and upward movement. Okay, so that's how the zygomaticotemporal is going to move, right? After, what will happen? It will give off the branch to the skin of the temporal region and the orbital margins. Means the skin that is present in the temporal region of your skull, right? And the skin that is there in the orbital margins, means the skin that is near to the orbit where your eyes are present. So this zygomaticotemporal is going to give branches to that particular skin regions, right? So the skin that are there in the region of the temporal bone and the orbital margins is going to be supplied by what? It's going to be supplied by the zygomaticotemporal nerve, right? It is a branch of what? The ophthalmic branch. Okay, so what will happen now? It will move further caudally and distributed at the base of the horns, and these branches are known as cornal branch. So let me show you that too. So you can see that this is the zygomaticotemporal. It is, wait a second. This is the zygomaticotemporal. It is moving backward caudally, right? And this is the base of the horn, right? And it is going to supply that particular branches. These branches are known as cornal branch, right? So I hope this is clear to you. So moving forward with the lacrimal branch, it is distributed along with the zygomaticotemporal. Okay, so the distribution is clear. That is going to be distributed by what? It is going to be distributed along with the zygomaticotemporal branch, right? Now after that, what is going to happen, that it will distribute or innervate to supply what? The lacrimal gland. So that's what the function of the lacrimal branch is. Okay, now coming on to discussion about the frontal branch. Sorry. So there are two things. I hope you are clear with the medial and the lateral aspect. Okay, so how's the origin of this particular frontal branch is? So we had discussed about the lateral lacrimal branch earlier, right? The second one was the lacrimal branch itself. Okay, now how is the origin of the frontal branches? So the frontal branch is going to be originate to the medial aspect of the lacrimal branch. See, the lacrimal branch is situated what? Laterally to the frontal branch. Okay, so the origin of the frontal branch is towards the medial aspect of the what? The lacrimal branch. Okay, so now what is going to happen? This frontal branch is going to pass through the orbit and reach the supraorbital canal. Okay, after following the supraorbital canal, it will exit through your supraorbital foramen to supply the forehead. Okay, so how it is going? So first of all, it is situated, the origin is what? It is the origin of the frontal branch is medial to the lacrimal branch. After the origin, it will enter the supraorbital canal via the orbit, and it's going to exit through the supraorbital foramen, right? With having a dorsal movement, means it will go upward and exit through the supraorbital foramen to supply what? The forehead. And it is going to distribute the skin of the forehead and the upper eyelid of the eye. Okay, so I hope it is clear that how the frontal branch is originating, how it is passing through the orbit and then carrying through the supraorbital canal. Then it will be passing through the supraorbital foramen and supplying the forehead and going to distribute and supply the skin of the forehead and the upper eyelid. Now talking about the nasociliary branch. Okay, so it is the continuation of the ophthalmic branch. Okay, so the ophthalmic branch that has been originated from the foramen orbitorotentum, it is the continuation of that particular ophthalmic branch. Okay, so the movement of this particular nasociliary branch is between the extraocular muscles. Means And these are the extraocular muscles. Extraocular muscles. Then this is your nasociliary branch, which is passing in between the extraocular muscle. And then what is doing, this particular nasociliary branch is going to divide into two nerve branches. One is the ethmoid nerve and second is the infratrochlear nerve. So the ethmoid nerve, it is re-entering, means it has exited through the orbitorotendum. Your ophthalmic branch exited the cranial cavity through what? The foramen orbitorotendum. Now after exiting, it is going to continue as what? The nasociliary branch. Now the branch of the nasociliary, which is the ethmoid nerve, is going to re-enter the cranial cavity. Okay, it is going to re-enter the cranial cavity through the ethmoid foramen. Okay, so there is a re-entrance of that particular nerve. Means it has exited through the foramen orbitorotendum as an ophthalmic branch, and that continuation of the ophthalmic branch was what? The nasociliary branch. Okay, so that particular nasociliary branch will give off two branches of the nerve, which is the infratrochlear and the ethmoid. So the ethmoid is going to re-enter the cranial cavity from the ethmoid foramen. Okay, and then leaves from the dorsal aspect of the cribriform plate. Okay, then it will be leaving the cranial cavity from the dorsal aspect of the cribriform plate to supply the mucosa of the nasal septum and the dorsal terminate of the nasal cavity. Okay, so means it is going to exit. The first one is the exit, then re-enter, then again an exit to supply the mucosa of the nasal septum, right? Now talking about the infratrochlear nerve. So the infratrochlear nerve move below the trochlear nerve. That's what the name suggests. So the name is itself making it clear the concept that it is an infratrochlear nerve. So it is moving inferior or below to the trochlear nerve. Okay. Then it will reach the medial canthus of the eye and ramifies to supply the surrounding skin, conjunctiva, and the lacrimus and the caruncle. Okay. So I hope it is clear. Now talking about the second branch, which is the maxillary branch. So maxillary branch is also going to be passing from what? Foramen orbitorotendum. Right? That's what the same exit is, as in it was in the ophthalmic branch. Right? So the maxillary branch, it is the largest of the three divisions. Means there were three divisions of the trigeminal from the seminal ganglion, which were what? The ophthalmic, the maxillary, and the mandibular. So out of the three, the maxillary branch is the largest of the. Okay, it is the largest. Okay, so now we are going to discuss about how it is going to pass. So talking about the passage of the maxillary branch, how it is going, what is the movement to be precise. Okay, so the maxillary branch is going to enter the foramen orbitorotendum. Okay, as I had mentioned it earlier also, then it is going to just subside in the pterygopalatine fossa. Okay, this particular maxillary branch is going to subside within the pterygopalatine fossa, and then it will exit the fossa to continue and enter a maxillary hiatus or the maxillary foramen to continue within an infraorbital canal. Means, first of all, it is going to exiting from the foramen orbitorotendum, then it is going to subside within the pterygopalatine fossa. Okay, means first of all it is entering right through the foramen orbitorotendum, then it is going to subside or just place itself within the pterygopalatine fossa, then it will continue in the pterygopalatine fossa. It will give several branches that I'll discuss it later. Okay, in pterygopalatine fossa, the maxillary branch will go give several branches that I'll discuss you later, and then after the pterygopalatine fossa, it is going to continue as in and enters in the infraorbital canal via the maxillary hiatus or the maxillary foramen. Okay, it is clear that it had entered the pterygopalatine fossa, it has subsided itself in the your pterygopalatine fossa, then it is going to enter the infraorbital canal via the maxillary foramen and exiting that particular canal via the infraorbital foramen. Okay, so those two foramens are going to give a passage for a canal, which is what? The infraorbital canal. And while the nerve, the maxillary branch, is going to pass through this canal, it will give several alveolar branch to supply the upper cheek tooth. Okay, it is going to supply the upper cheek tooth by giving the alveolar branch while it was in the infraorbital canal. जब वो infraorbital canal में थी, जब वो pass कर रही थी, then it will give what several branches to the upper cheek tooth, which is known as the alveolar branches of the maxillary nerve. Okay, then it will pass downward and divides to the number of branches and ramify to the nostrils and the upper lip. Okay, so the upper lip and the nostril is going to be what supplied by the maxillary branch. Now, as I had mentioned earlier, that while the maxillary branch was in the pterygopalatine fossa, it will give several branches, right? So the name of the several branches are as following, like the zygomaticofascial, which will enter the orbit, move through the lateral walls of the orbit, then it will distribute to the lower eyelid and the skin. Okay, the caudal nasal branch that has been given from the maxillary branch while it was in the pterygopalatine fossa, it will passes through the pterygopalatine foramen and innervate to the nasal mucosa membrane. Okay, then it's the anterior palatine, which supplies the hard palate and the gum of the upper jaw. Okay, then it's the posterior palatine, which move forward downward sorry, from the pterygopalatine fossa to innervate the soft palate, right? Then it's the lateral nasal that will supply to the lateral aspect of the nasal mucosa, and then the dorsal nasal, which will supply the dorsal mucosa of the nasal cavity, right? Now, discussing about the last branch, which is the mandibular branch. So if we talk about the mandibular branch, it is the mixed nerve, means it is both sensory and motor, right? It is both. It will serving as a sensory nerve and as a motor nerve. So talking about the movement of this particular mandibular branch, so how the mandibular branch is going to form a path. So first of all, it is going to originate from what? The seminal ganglion. Then it will pass through the foramen ovale as in mandibular branch. Okay. After the seminal ganglion gives three branches, right? Ophthalmic, maxillary, and mandibular. So this particular mandibular is different from the above two, as the above two nerve or the branches or the trigeminal are going to pass from what? The foramen orbitorotendum, while this particular mandibular branch is going to pass from what? The foramen ovale. Okay, it will move ventrally and lateral under the pterygoides lateralis muscle. Okay, this is clear that it will move ventrally means downward and away from the midline means laterally under the pterygoides lateralis muscle. Okay, and will give the following branches that I had mentioned earlier, mentioned here over here. It will give several branches that are there in the chart, and the ultimately it will give final two branches, which will be the lingual nerve and the mandibular alveolar nerve. Means after they exit from the foramen ovale, this will move ventrally and lateral to the pterygoides lateralis muscle. Then what will it be doing? That it will give several branches that I had mentioned over here, and ultimately finally it is going to end and terminate into two last nerve branches, which is the mandibular alveolar nerve and the lingual nerve. So talking about the first one, which is the pterygoid nerve, so the origin is ventromedial aspect of the mandibular nerve, okay, and the innervation is to the pterygoid muscle, means the pterygoid nerve is going to supply to the pterygoid muscle. Okay, now the next is the buccal nerve. The origin is it branch out from the closure to the foramen ovale, means after the entering of this particular mandibular nerve through the foramen ovale, it will branch out at the starting of the branch itself and near to the closure of the foramen ovale, means close to the foramen ovale it is going to be branching out. Okay, and then it will going to supply the temporalis muscle and cross the maxillary artery and innervate the following, which is the buccal gland, the parietal gland, and the mucosa of the cheek. Okay, then after that it will be going to communicate with the dorsal buccal branch of the facial. Okay, means first of all, it has supplied to the temporalis muscle. Then it will cross the maxillary artery to innervate the buccal gland, the parotid gland, and the mucosa of the cheek. Afterward, it will communicate with the dorsal buccal branch of the facial nerve. That is going to be end of this particular buccal nerve branch from the mandibular. Okay, now talking about the next, which is the mesenteric nerve. Okay, so this particular mesenteric nerve is small, okay, and passes through the mandibular notch, okay, and the supply is to the masseter muscle. Now next is the superficial temporal nerve. It is the origin of this particular nerve is at the caudal border of the parent trunk. Okay, so what is the parent trunk over here? It is the mandibular branch. Okay, so it is going to originate caudally, means back from the backward border of this particular mandibular branch, right? And then what it is going to do, it is wind around the mandible, means this particular superficial temporal nerve, it is going to wind, means if this is the mandible, it is going to wind around. It is going to wind around the mandible and comes under the parotid gland. Okay, after winding around the mandible bone, it will comes under the parotid gland to give following two branches, which is the transverse facial and the auricular branch. So the auricular branch is ultimately going to supply the anterior ear muscles and the skin, and along with that it is also going to supply the parotid gland. And the transverse facial, it will join the buccal branch of the seventh cranial nerve or the facial nerve to supply the skin of the masseter area. Okay, so the skin that is there in the masseter area, it is going to be supplied by the transverse facial branch that has been given by the superficial temporal nerve. Okay, now talking about the last two, which is the mandibular alveolar nerve and the lingual nerve, which is going to be terminated from the mandibular branch, right? So how the passage of this particular mandibular alveolar nerve is, it will pass caudoventrally, okay, means backward and downward, okay, and then it is going to detach to give a mylohyoid branch to supply the mylohyoid and the digastric muscles that is there. Okay, means the mandibular alveolar nerve is going to branch out to give the mylohyoid branch. This particular mylohyoid branch is going to supply what? The mylohyoid and the digastricus muscle. Now it will move along the foramen, which is the mandibular foramen. Okay, this, as it was similar, it is going to enter through the mandibular foramen. Okay, mandibular foramen, pass through the canal and exit through the mental foramen. Okay, so this mental foramen is giving the exit to this particular nerve, and which is the mandibular alveolar nerve, and the entrance of the mandibular alveolar nerve to the mandibular canal. This is the mandibular canal. Okay, this is the mandibular canal, right? So the entrance is given by this particular thing, which is the mandibular foramen. The entrance to the mandibular alveolar nerve is given by what? The mandibular foramen, and the exit to this particular nerve is given by the mental foramen. And while it was in the mandibular canal, it will give branches to the lower jaw teeth. Okay, now coming to the last, which is the lingual nerve. So lingual nerve is going to join the terminal branch of which is the cauda tympani, okay, and ramifies and supply the anterior 2/3 of the trunk. Okay, so this was all about the trigeminal nerve. Okay, so at last there's a condition also which is known as the trigeminal neuralgia. So what does the trigeminal neuralgia is? So as you are understanding, wherever means wherever the trigeminal is innervating, it is giving what? The sensory and motor functions, right? So what happens sometimes in the facial muscles or in the region where the trigeminal nerve is innervating, it feels severe pain. Okay, there is severe pain that has been felt in the regions which has been supplied by the trigeminal nerve. In order, there isn't any etiology that is confirmed until now. Okay, the etiology or the cause for that particular severe pain where the trigeminal nerve is innervating is unknown until now. So the severe pain that is felt in the region where the trigeminal nerve is innervating is known as the trigeminal neuralgia, and until now the etiology for that particular condition isn't been set up. Okay, so this was all about the trigeminal nerve from my end. Okay, so thank you everyone, have a nice day.